All right, well, thank you for coming. I hope everyone had a nice Passover, Easter, or whatever other occasions that you managed to commemorate over the course of the last week. I had a nice, restful week. Got a lot of work done that I had been unable to get to, including getting my taxes filed, so that was good. Let me start by talking about the meeting I just came from. We have, in effect, achieved our goal of universal access to health care in Montgomery County. And what has occurred in the last 2 years under the Affordable Care Act is that 75,000 residents of Montgomery County have either been enrolled in the exchanges or have access to Medicaid coverage who previously were not eligible, leaving, we estimate, between 25 and 35,000 residents of Montgomery County who are not enrolled in a health insurance plan for one reason or another. The capacity of our Montgomery Cares clinics for the coming year is greater than that. So we are confidently able today to say that any resident of Montgomery County has access to health care, and we have, in effect, achieved our goal of universal access. That's something that we should all take great pride in, and it is thanks to the Congress and President Obama and their efforts to implement health reform and access to health care across the United States. Our results are not by any means unique to Montgomery County. What I think is unique is that the balance of people who are not covered still have the option of getting care at one of our Montgomery Cares clinics. So I do think that our efforts to provide access are directly related to what I discussed at our last meeting, which is that Montgomery County is the healthiest county in the state of Maryland, according to the rankings released by the Robert Wood Johnson Foundation. And I think some of my comments 2 weeks ago intentionally focused on some of the policy initiatives that we've put forward, including labeling of calories on menus and our current effort to restrict toxic chemicals on people's lawns. But I think that, and as I actually said 2 weeks ago, but the media didn't pick up on this particular point, the most important element of health is access to health care. And for a decade now in Montgomery County, we have made it a priority to ensure that our residents have access to health care. And again, because I just think it's something we should all take great pride in, we have in effect achieved our goal of universal access to health care in this county. We're embarking upon 5 public hearings this week, Tuesday, Wednesday, Thursday, afternoon and evening public hearings. We will hear from a couple hundred at least members of the public, and we're eager to hear from them. Our witness lists for all of the 5 public hearings are full, but all of us, council members, are accessible to our constituents through email, phone call, stop us in the grocery store, whatever it is, if you have input on the budget. But our witness lists for the public hearings are full, and we are delighted to have really strong participation from community members in these public hearings, which I know all council members rely upon because of the input they receive on what's on people's minds. The budget is, of course, a statement of our policy priorities, and so we determine those by listening, and we will do a lot of listening this week. We're still awaiting the outcome of the state budget. Last I checked, the House and Senate leadership and Governor Hogan were still bouncing back and forth with offers and counteroffers. So whether sine die tonight will mean that the budget is resolved for fiscal 2016, I don't know, and I don't think anyone is in a position to say. I think they're furiously negotiating unless there's other news that has come out since I last heard. Now, the final outcome of the budget for the schools are, of course, the largest component of our budget, representing more than half of our total budget. And if you start with the county executive's recommendation, the county executive's recommendation would be $37 million below what the school system asked for if the state does provide us with the Geographic Cost of Education Index and the restoration of the reductions to the school's budget that Governor Hogan recommended at the beginning of the process, but that the Senate and House appropriators wanted to put back. So in any event, the gap between the school system's request is either $54 million if we don't get any of the money from the state, or $37 million if we do. We understand that the needs in the school system are very real. It is important to keep in mind that out of a $2.5 billion budget, a gap of $37 million is just slightly more than 0.1% of the entire school system budget. So wherever we end up, we're very, very close to what it is that the school system asked us, but we acknowledge that the needs are very real, and all council members are committed to doing the very best we can for our education system, which is our number one most important purpose here in local government. So I'll yield for any questions or anything that any of you may have on your minds.
So tomorrow, I think Councilmember Florine is proposing a resolution about the energy tax reduction. So I was curious for your thoughts on that, and also I've talked to citizens who really want it repealed as they feel was promised in the last major rain.
Right. There's no doubt in my mind that the presence of the energy tax harms Montgomery County's competitiveness. I absolutely think we need a plan to restore our competitiveness. If you look at the various taxes that Maryland imposes vis-a-vis those that Virginia imposes, Virginia has certain types of personal property tax that we don't have in Maryland. It's hard to equate apples and oranges precisely, but it is a disincentive if we're trying to keep companies here, especially companies in information technology or manufacturing or processing or areas that are very electricity intensive. There's no question that the energy tax is a problem for our efforts to retain and attract business. So we're all very much aware of that. I will not be a co-sponsor of Councilwoman Florine's initiative. As council president, I'm being very cautious and judicious about what measures I put my name on. I've always interpreted, and I think the press interprets, that when the council president puts his or her name on a piece of legislation, it's because it's likely that piece of legislation is going to be enacted. And at this early juncture, I'm just not able to project forward. I want to see a reduction in the energy tax. I'd like to see elimination of the differential in the energy tax over time, but how much progress we'll make this year, it's premature to say, and I'm not putting my name on Councilmember Florine's bill, but I appreciate her making sure that it's part of the dialogue.
So if there's a stalemate in the budget, the state budget, the county stands to lose how much money potentially?
Well, for schools, we've got a gap of $23 million that we're hoping that the state will free up for us. There are other funds with respect to Medicaid, with respect to mental health, with respect to developmental disabilities. So there's a lot of funding streams that the House and Senate tried to restore that we just don't know the outcome yet, and Governor Hogan is sitting on those dollars.
If it doesn't come, how?
Well, then we'll discuss it in our own budget deliberations, and it's premature for me to tell you what the outcome will be.
As far as the campaign financing law that you guys passed in your budget, are you going to be able to save some money and put some money in?
So that's a great question, and that's very much on council members' minds. The first discussion of that topic will take place in the Government Operations and Fiscal Policy Committee. I know that the chair of that committee wants to highlight that as a topic, and it is also likely that we will be putting together an informational forum for the public on the terms of our new law, and the date of that is yet to be determined. We're working on that. So the County Council is squarely behind the public campaign financing law that we passed last year, and it is 4 years. We have 4 budgets in which we can fund the initiative. I'd like to see some down payment this year. The county executive put 0 in his budget for this purpose. So we're just beginning that conversation, but it certainly will get a lot of attention, and council members remain fully committed to having public campaign financing in place in 2018.
Being Health and Human Services, the e-cigarette bill that you guys are looking at, your response, or
Yes.
talk about
Yeah, it's striking that e-cigarettes are not today subject to tax, and I think that this is a good revenue opportunity for Montgomery County, and I'm supporting it, and I congratulate Councilmember Hucker for putting it forward. I think we can raise revenue that will assist us with our budget challenge this year.
And in what capacity? I mean, how much tax? And do you think it'll pass?
I do think that a tax will be imposed, and do we have a projection on the revenue that we may raise? We're working on that.
Okay.
Go ahead. Yeah.
Switching gears.
Sure.
If Kate Ryan would be here, she's in
Quite all
the
right.
General Assembly.
Glad you're
so,
here.
Maybe not. So, you know, the free range kids.
Sure.
Your reaction to the parents not being notified after the kids were in custody and you weren't notified for hours?
Right.
So this morning in the HHS committee, which I chair, I asked Uma Alawalya, director of the HHS department, for an update on the situation involving the Métis, which was reported extensively in the media this morning. When a call is made to the police to report that children may be unattended or unsupervised, protocol requires that the police must respond. After responding, police are required to call Child Protective Services, and it is the responsibility of Child Protective Services to communicate with the parents. It is my understanding that the required protocol was followed in this case. State privacy laws prevent a detailed discussion of the case by the department director or any HHS workers who are privy to the individual details. What I can tell you is that our HHS department is working with the State Department of Human Resources to determine the timeline of events and ensure that all appropriate steps were taken in this case. I'm the father of 2 sons myself. I can understand the feeling of concern that occurs when your child does not check in as expected. I'm glad that the children were found safe and that the family has been reunited.
Another question. There are no laws that limits kids being outside, age-wise. I mean, at home, you know, there are age requirements if they're left alone. Is the council, in light of this, thinking about passing any kind of legislation?
All of the laws that are in place regarding abuse and abandonment of children are state laws. So if there were changes to these protocols that I mentioned in law, they would need to occur in the Maryland General Assembly. Anything else?
What other questions do you have for HHS
On
about this case?
this topic?
Mm-hmm.
I asked the director first thing this morning for an update on the case. I am sensitive, very sensitive, to the fact that the information is all being provided from one source, that is the parents. I think the government is under strong privacy constraints for good reason. And so it's important that we understand that most of what we're hearing is just one side of the story. And I'm trying to ascertain whether all appropriate protocols were followed and a timeline, you know, clearly at issue is when were the parents notified? And none of us would want to be, I'm a parent myself, none of us would want to be in a situation where we don't know where our children are. And so the department is working to reconstruct the timeline and ascertain whether its employees followed appropriate protocols.
And how did you first hear about this case?
I woke up this morning to a ton of messages in my email inbox and on Facebook from constituents who were forwarding to me the news coverage.
And was there a theme in these emails?
Some constituents took the side of the parents and some constituents took the side of the government.
Was it 50-50 or did you see more?
I'm not going to try to put a ratio because it wouldn't be scientific, but I heard from constituents on both sides of the issue.
Switching topics, Chris Van Hollen has picked up endorsements now from Prince George's and Frederick County. So, again, I mean, what do you think it means that he has such a majority of support from these 3 counties so early on?
Well, I'm very public in my support for Chris Van Hollen. He has my complete confidence. He's been a superb member of the House under very adverse circumstances, and I think he knows how to work across the aisle and get things done even in an environment that's not so favorable for Democrats. He's done that in the House, and I'm very confident he'll do that in the U.S. Senate, and he has my full support.
Vandalism at the Shaare Torah case. You issued a statement. Could you share your reaction?
I attended the service, and I wanted to show my solidarity. Any community that is targeted for hate crimes deserves our support, and anti-Semitism is a relic of history that Montgomery County should be better than that to have public expressions of anti-Semitism. It's very disturbing that we would encounter that in 2015. I know that the police have some leads on the case. There was a security camera at the synagogue which captured film of the act of vandalism, so the police are pursuing it vigorously, as they should. It's a hate crime. Anything else? Okay, I really appreciate everyone showing up for these weekly meetings. I hope they're helpful to you.